to our Pacific Islands broadcast. And today is May 5th. This is the first Wednesday of the month of May. O ko le ke hu whangai be ngai tala whatak ko tope o sana whaket me polo kalamani. Ka o ko mahu inga whoke tau kau whataha. Ai ko e whamawhalea ni ai hoa o e Pasifiki. Pea ko ia o kui kai ngata pe e kautonga, kau Hamoa, kau Marshallese, and also the Fijian. So, ko ki taimere ahoni, today we just have a different time because due to some other event. And so we want to do it like 3 to 5. Ai ko tolu ki ni ma I ahoni. Pea ko ia ko e not only that, this coming up Sunday, we also want to value and acknowledge the value of all mothers worldwide. And so we have a very important topic today to talk about, and we'd like to welcome our communication specialist from the King County here in the Seattle area. It's Christina Frederick. She took her time to make it available for all the Pacific Islanders, because there's a lot of relevant information that need to be shared with our community at large, especially the Pacific Islanders. O tau whawheta I peko I ngā koe tau kau whataha I hoa koe ni, pa ko whamalofo ki I he taimini. O tau I lotoni ai pa mo Hoklani, ka pe whaka Christina, whamalo atu. And so sorry, even though that's not going to be a lot of the viewers, but I would like to acknowledge those that are already inside. Mumui Tukutau Si Paleta Liti Moa, Sajinda Tawa Taylor, and also Hokulani Sam Lomoli. For those of you that are already inside and join us, like you, Sajinda, that's also part of it, half Tongan and half Samoan. Ko iai pe ha mo ngai fe hui ke vahe mai. Pe ka ha mo fe hui fe ilo he ko ngā ko ngai tala noa ko ni. O apply pe ia pe e tokoni. Fe pe ha fe tu I mamani pa mo Amerikani. O ko ke fe ilo ka ngai tokoni e pure anga ko me ta tau pe te mau I he ni. Ko me ta tau pe te mo mau I ho mo ngai state. Ko ia te ukolang le ke tukang e whainga maali ko ni welcome Christina Frederick, ko communication specialist here ai King County, ai ko county lai tahai ni I Washington State, ai ko ni mau no foi, ai au ne ka vai ko Seattle Washington, me ngai feitu ke he I ho mau feitu oni. Welcome Christina. Thank you
Thank you.
so much for taking the time to always join us, Almost every week, we have an announcement and also a dialogue and a focus group, from the King County staff. Christina, welcome to our program today.
Thank you so much. We really enjoy being here, and thank you for this opportunity.
Sorry for the inconvenience of today because normally we always start at 6 o'clock on Pacific time. Aya ko time ko a California, Seattle mau time tatau. Ka ko ahoni mau ki le e mai ke tolu ko nga lahi ngai fatongia. Because today we move it, for 3 o'clock, But even though that the people may not be available right now, however, they are going to join us, they will also watch, the video that is going to be on YouTube and also on Facebook. And it's reachable, to globally. Okay, Christina, I know that there are some questions to make sure that the people have the latest update. So yesterday there was some news about the King County and the state reopening. Can you share the latest news, please? Thank you.
Yeah, so yesterday we had what people may or may not know is part of what's being called the Roadmap to Recovery. Washington State has a plan for safely reopening so that businesses and restaurants and the economies can open up, but at the same time, people are staying safe. And part of this plan is that every 3 weeks, every county is looked at. The state looks at the number of people being hospitalized due to COVID-19 because we want to make sure the medical system's not overwhelmed, and the number of new cases of COVID-19. And based on those numbers, a county may go forward to phase 3, or it may go to phase 2 that has more restrictions. A lot of counties in Washington state right now have had new cases and hospitalizations indicating that they should go to phase 2, which is more restrictive. But yesterday, the government made an announcement that there's going to be a pause on moving anything. So all counties that were in phase 3 will stay in phase 3. And what we see happening, and the reason this is very interesting and why there wasn't any action taken, is because numbers are plateauing. So cases have gone up, they're not at safe numbers, and hospitalizations are higher than we'd like to see them. And there's a lot of reasons behind this, but they went up and now they're steady. So we're taking 2 weeks right now to pause to see if there's any changes in the numbers before it's decided on any phase changes. So right now in King County, the same phase we have been in, which means restaurants are at 50% capacity. And then we still very, very important for social distancing, not doing large gatherings outside of your household, and wearing masks. We think that these numbers have gone up because people have let down their guard a little bit, maybe expanding their social circles, not only wearing masks. And another really important thing to know is that a lot of these infections are from variants. So variants are more contagious and they spread more. So it's really, really important right now to be careful, not only to keep King County in phase 3, but also to keep people safe. And one of the best tools we have for that right now is vaccines.
Thank you so much, Christina, for explaining this. I'd like to ask Hokulani.
Mhm.
You, Hokulani, can you please go ahead and ask, if you have any question or any concern about vaccine or any related question, for the COVID-19, for the, yeah.
Hi.
Hi there.
Hello. One of by the way, my name is Hokulani. Thank you, Fatima. One of the questions I would like to ask is that, is there any other ways to get the vaccine? And what are the age? And from my understanding, the last time I heard was 17 and older. Have they changed that to have it any younger than 17?
Yeah, it's if you're at a place, if you're able to get the Pfizer vaccine, that is 16 and older. So 16 and 17-year-olds can receive the Pfizer vaccine. For Moderna and Johnson & Johnson, that's age 18 and older. We're expecting soon that Pfizer will also be approved soon for children as young as 12, but that is just pending and that's nothing official yet.
Okay, thank you. It's just that I have younger children. I was asking.
Yeah.
And if it's okay, can I ask another question?
Of course.
Yes, go ahead.
The other question I have is, myself, I've already received both of my COVID testing, and then listening to what you just reported as far as the numbers.
Mm-hmm.
Is there any report that has anyone after taking the vaccine got COVID? I'm curious.
Yeah, there are what we call those is you may hear about breakthrough cases. And those are cases of people who received the COVID-19 vaccine and then still COVID. So what we know, this is pretty typical with vaccines. When we talk about 95% efficacy, we know that there's a small number of people who will get COVID. So this is a very, very small number. And what we're seeing is when people do get COVID, that they're not hospitalized and that symptoms are very mild. So Yes, it happens, and that's the nature of vaccines. They're not able to protect 100%. And then with variants, um, we don't know. So Pfizer and Moderna seem to protect really well against the most common variant, which is the one that originated in the UK. But there's also some variants from California, from South Africa, and we don't usually know about those until after they've been circulating in the population for a while. So, good to get back to your question. There are breakthrough cases, and they're very rare. And with the vaccines, people have really strong, good protection. And when there are those breakthrough cases, they're not as severe and they don't require hospitalization.
Thank you. So just with that little amount of percentage of people of the breakthrough, do you know if these clients or patients had COVID before they taken their vaccine, or these patients that never had COVID but had taken the vaccine and still was affected?
I don't think we track that, but we can. I can look that up, and I can go through Sylvia to get the message back from you, back to you. So, yeah, and we'll see the data that we know on that.
Oh, okay, sure. Thank you, Lani, for asking those questions. Hokulani Lomolis is currently working for the city of Seattle. And so there are a lot of, assistants, from the city. What should people know about getting the vaccine? What should they know about now? If there is a new, before they have to have an appointment, it was only for the oldest, and then it was coming down to 16 and a half. So uh, what are some new information that the people should know about getting the vaccine now?
Yes. So part of the reason that we think we saw this plateau, which is why there is, we're waiting and seeing, because the vaccine has become very available in Washington state. So we think that's why the rise of cases has kind of evened out. And it's very available. So anybody who is 16 years and older is eligible for the vaccine. And as I mentioned previously, if the person is 16 or 17 years old, they will need to receive Pfizer. You can also get it at the King County sites that were previously only for South King County residents are now open to all zip codes. And in addition, you don't necessarily need an appointment. So a lot of sites have walk-up availability. At the King County sites, there are 1,000 walk-up appointments available each day. So even if it's difficult to plan for your work, or maybe you didn't know ahead of time, but you have a free afternoon, you can now just walk up and get a vaccine the same day. And the wait times are not very long, and they'll register you and get all the paperwork. And just a reminder that the vaccine is no charge. You don't have to have any proof of insurance or have a provider. And you also don't need any documentation of citizenship.
Okay, thank you so much, Christina. Um, what should a person expect at the clinic?
Yeah, so if you're going to a large volume vaccination site, such as the one in Kent or Auburn, ran by King County, or the one in Lumenfield by the city of Seattle, if you have an appointment, what we're hearing is people are in and out in about 20 minutes. And this includes observation time of after. It's a little different for everyone, and probably depending on the time of day, but it's a pretty quick experience. So if you have an appointment, people will get you signed in. If you don't have an appointment, you can register as a walk-in. You'll get your vaccine, and then just to make sure you don't have any allergic reactions or adverse side effects, you'll stay at the clinic for about 15 minutes. And if you have a history of allergies, they might keep you a little longer, about 30 minutes. And this is just to make sure everything goes well and everything is okay. And if somebody doesn't like the large volume site or maybe nervous to go to a big center or be around a lot of people, we recommend that you check with your medical practitioner, your doctor, or a pharmacist that maybe you go. And a lot of pharmacies and offices are giving shots as well. If you know you have a big group that you think that still needs a vaccine and they might not want to go into a clinic, you can always email community vaccination events at keenecounty.gov. And people in Keene County will match you with a vaccine provider. And then that can be administered at a church, at a school, a community center. A parking lot where you can use, just anywhere where people feel safe and comfortable within their community coming for the vaccine. And that's often really great when people have people who they are familiar with around them. Mhm. 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 Yeah. Mhm. Yeah, no, that's an excellent question. You can now receive the Johnson and Johnson vaccine, and it is one shot. So this is a large advantage to people. Sometimes people decide to get Johnson and Johnson because they know they have travel coming up soon. So just the one dose is easier. Or it's great for people who are more mobile or transient or may have trouble returning to a vaccine site a second time. So Johnson and Johnson is still being used. And when you sign up for sites, they will tell you which vaccines are available and which vaccines you will be administered. As you mentioned, there was a pause on the use of Johnson and Johnson. There was a very, very small amount of cases of a rare blood clotting disease. So we that pause was used to figure out if that was connected to the vaccine and to let physicians and patients know what to look for. So now that was created during the pause. So if you receive the Johnson and Johnson vaccines, you'll receive details on what is side effects to be really aware of because they could signal that this rare blood clotting disorder is happening. But again, it's really rare. So it was literally 1 in a million people who had this reaction. But we have a vaccine safety reporting system in this country, and it's really good at catching things early. So we were able to catch that within Johnson and Johnson, and now providers are more aware of what to look for, and you can still get that vaccine, which is a great choice. Yeah. Correct. Only one shot, and then 2 weeks after you have full protection. Yeah. Mhm. Yeah. Yeah. Yeah, so starting with a couple things. First of all, masks are still one of the most effective tools we have in stopping the spread of COVID-19. They work really well. They protect the people around you. It really keeps the virus from going from person to person, especially when it's asymptomatic. So I just want to reinforce and say very clearly that masks are important and they are a really valuable tool, especially when protecting our loved ones and people around you. With summer, we do see illnesses such as we saw a drop in COVID last summer, and we saw a drop. We see a drop in the flu during the summer, and this is usually for a couple of reasons. One, people are outside more. So we know ventilation is so important for COVID-19. One of the places people are most susceptible are in closed buildings with no ventilation. So good ventilation in buildings is really important. But when it's summer and you can keep windows and doors open or be outside, that's natural ventilation that just really helps because COVID is in the air. And the less ventilation, the more concentrated it is. The more ventilation, the less concentrated it is. So that's why we see a lot less of these airborne diseases in the summer. That being said, last summer there were still many, many cases of COVID-19. So we want to continue to be safe. What the CDC has said for masks, which is some exciting news, if you are fully vaccinated, using the data that we have, the CDC has determined that it is not a risky activity if you're outside with other vaccinated people without a mask, or if you're within your household. So if your family's going for a walk through the park, or you're with your other vaccinated friend, maybe doing a walk in your neighborhood, masks are not necessary. And then, so that is great news.
So, if you walk around the neighbor, you don't need to
Yeah,
wear a mask, eh?
right. If you're
Oh,
with
okay.
people in your household or another vaccinated person.
Okay.
But if you were outside, so say there was an outdoor concert and there was a lot of people, or a farmer's market or a festival, any situation like that, you would still want to wear a mask. But small groups of vaccinated people, it's no longer recommended to wear a mask when you're outside or when you're inside with other vaccinated people, which is a great reason to get vaccinated, giving you that freedom, getting to see your friends smile, being able to hug and share that time together is really, really nice. Um,
Um, yeah. Hokulani, are you still on? Lani? Yeah, okay. I think that one of the questions too that the people want to know um, about the travel. What is the requirement, for travel? Do they need to have the vaccine to travel, or do they just need to get a report from the doctor that they're not COVID, affected person?
Yeah, so it's recommended, especially for international travel or longer distance travel, that you're fully vaccinated before you travel. If you are not vaccinated, it really depends. So leaving, it depends on your destination. Different states have different requirements. You may need to quarantine once you go to a state. For example, we have friends who live in New York, and if we were unvaccinated and visiting them, New York would ask that we stay in a quarantined area for 10 to 14 days. There's also Hawaii has very strict requirements. They require a negative test before you go to Hawaii. In different countries have different requirements. So usually when you make your plane reservations, you'll receive an alert about where you're traveling to. You can also Google CDC guidelines and you can see what's needed when you travel. When you return, the United States for vaccinated and non-vaccinated people requires a negative COVID test. So you need to have that test 3 to 5 days before you return. and
Okay.
that's a viral. What you want is the viral COVID-19 test that tests for active virus, and you have to show proof of that upon coming back into the country.
So the answer, I just want to make sure that I got it cleared. You need to get your test before you leave to prove that
Mhm.
you're not affected by COVID 19. And then
Exactly.
when you return back to the country, back to
Mhm.
here to US, you also need to get a test from the country where you were. Is that
Mhm.
right, Christina?
Yes, that's right. And for when you travel to a place, there might be different requirements for every place you go. So
Yeah,
it's good to check that before you leave, especially as things change very quickly. But
right.
right now, for the US, you do need to have a negative COVID test to return.
Oh, I see.
Yeah.
Okay.
And while you're traveling, just a reminder to take all of the same precautions, especially on the airplane. Keep your mask on, do your best to social distance. Those things are all still very important.
Christina, I have some people that were just texting me. They are not able to ask the question, but they said, what are some of the assistance that the King County are able to help out with the people, if you can get that clear, with the people that are locked down here in the country, especially here in the King County, if they are not permanent residents or citizens of this country, what does the King County have service, available to help them out?
Yeah, so I'll start with if somebody tests positive for COVID-19. So, and just reiterating, if you have not received a vaccine and you've been exposed to COVID-19, or maybe you have a cough, tightness in your chest, a fever, please get tested for COVID-19. Testing is still very important
Out.
because we want to stop
Yeah, so
the spread. And when you test positive, somebody will call you who's a contact tracer. So part of the contact tracer's job is to know who you've been with. So other people may need tests. So they don't collect personal or confidential information. But if you were to tell a contact tracer that and they don't judge what you've done or where you've been. But if you were to say, I was at a small get together with friends, the contact tracer may let them know so they can get tested for COVID as well and take the appropriate steps. But also, what that contact tracer does is connects the person with services. So that contact tracer will ask the person if they need any help paying their household bills, if they fear that they'll miss work and that they need help with groceries, if they're nervous about something and may need legal assistance, if they cannot isolate in their own home safely and might need a hotel or a place to stay. The contact tracer will help with all of these. So, so if a person is tested and the test is positive, the contact tracer will offer services and make sure they have everything that they need. We also know, I'm just finding the number, when people have just the environment of businesses maybe not being open, people losing their jobs. We know those have created a lot of hardships. So King County has the Community Health Access Program. And this is something that anybody can call or email. And they may be able to, they can do everything from helping you sign up for free health insurance or very low cost health insurance, to connecting you with affordable doctors, dentists. They can to connecting you with other services in the county, maternity support, basic food program, energy assistance for your household. So again, we call that the CHAT program, which stands for Community Health Access Program.
Community access program, eh?
Community Health Access Program, and there's two ways to reach them. You can call or you can email. So the phone number to call is 1-800-756-5437. So I will repeat that one more time. 1-800-756-5437. And I'm going to put those in the chat right now as well.
Okay, Christina, I have someone on the line.
Yeah.
Wanted to ask a question, or I don't know if what you wanted to share. Go ahead, Lala.
Yes.
Lala is from the Marshallese community. Lala,
Nice to
go
meet
ahead
you.
and ask your question.
Hello.
Hi.
This is Christina.
Can you hear me real good?
Yes, we can hear you.
Okay. Okay. Just want to know if you think the wearing the mask is safer for everybody, or is it good for everybody to like? Is it really like 100% safe to wear the mask around people?
Oh,
Yeah.
so your question is like asking. Oh, you can hear it, Christina?
Yes, I believed, correct me if you're wrong, but you were asking if masks actually help and if
Oh.
it improves safety to wear the mask. Is that right?
Yeah, is that your question, Lala? Is wearing masks help?
Yeah, does it help? Like, is it like really? Is it like 100% safe for everybody to wear it, or is it for us to? Is it a like rule to wear it? Like everybody needs to be wear it because the government they wear it, or the public also
Right.
wear it.
Yeah, I think I got that clear, Tina. I think what she's trying to ask, is it just the rules for us to wear the mask, or is it help? Tina?
Yes. So what I'm going to say is many places have it as a rule because it helps. So I'm going to after this, Sylvia, I'm going to send you a very interesting video about masks. And if you want to save it to your Facebook page, but it just shows somebody sneezing and coughing with or without a mask. And you can see how the virus or the bacteria is, how much more gets out when you're not wearing a mask. So I'll send that your way. And I think it's very interesting, or people can look that up online. They are not 100%. I think that was part of your question. They are not 100% protection, but they greatly reduce, if both people are wearing masks, that can reduce the chance of getting COVID-19 by 95%. So we know that when people speak naturally or laugh or cough or sneeze, the particles come out of their mouths, and these are the particles that carry COVID-19. And especially when people may not have symptoms, so asymptomatic COVID-19, these particles are still moving out and going into the air. And with a mask, a significant less number of those particles go into the air. So they really do work, and they work really well. And I know people ask a lot if it's safe to be wearing a mask so often, but I always think of surgeons, and there's surgeons who do 14 and 16-hour surgeries, and they're wearing a mask the entire time. And the reason they're wearing it is because they know the patient is very vulnerable, and the mask will protect that patient while they're in surgery from the doctor accidentally infecting them with anything. So I'm a big fan of masks, as you might see, but it's because they work, and they work really, really well. And if you're ever not sure, try blowing out a birthday candle with a mask. It's very difficult. You can tell that it's blocking the air, which might be carrying COVID from getting out.
Oh, I think that's a really good question. Thank you. Thank you, Lala, for asking that. Yeah, I heard a lot of our people in our community, asking that. Is it, just like we just wearing the mask just because of the rule, or
Right.
is it safe? And I'm glad, Christina, you did explain that very well, to clarify that how important it is. Og matu ak mau inga beke tui e tau ngai mes. O ange kone whātātāgo ngā puha whai keke. Pea ulawa ke tā ofi ai ngahi e a ko hau te manawa aki. Mea hau e ngai siemu. Okay, Lala, what's your next question?
Hello?
Lala?
Yeah, my next question is, what about the kids? Because most of the time, people just like older wear masks, but not the kids, So what is the difference between kids and older people? Why do older people need to wear masks and they don't even complain about kids not wearing it?
Yeah, so the official advice is that children over 2 should be wearing masks. And the reason why not smaller children, or there's that threshold, is because you definitely want the child to be old enough so that the mask doesn't, the same reason you don't put a blanket over a baby's face because the baby can't move the blanket away. You want the child to be old enough to have the coordination to have the mask on and stay in place. And if something were to ever happen, such as they could remove the mask if they were in danger. So that is why very, very young children don't wear masks. But as children are 2 and 3 years old, it is advised that they wear masks. So airlines will advise this a lot. A lot of businesses reinforce that. I've seen some businesses say, I've seen 4 and 5 years old and over need to wear a mask. And I think it's safest when everybody who's about 2 or 3 years and older is wearing a mask, because you're right. Children don't have, COVID does not look the same in children, but they can still carry the disease and they can still pass it on to people who are really vulnerable.
Laura, do you have any more question? I hope you heard everything that Christina was explaining. Yeah. She did.
What about those with asthma problem?
Oh, she said, what about those, that have the asthma problem? Lala, you got all the great questions today.
No, this is fantastic.
Yeah,
And
I
think
know. I love those questions.
it's so
Lala
smart.
got the award today.
So to share personally, I have asthma, and
go outside with music. So like send us to go home without wearing mask, then you can lose your job. Then we just want to know what is the importance of wearing that thingy? Because some people they have asthma problem, and still they need to wear that thingy. Like me, I work as a RAM agent, and working inside the plane, picking up luggage and everything with that mask on, it will kill you,
Oh.
But you still need to wear it.
Yeah, I think it was her question was about, what about the people that have asthma problem? Okay, Christina. Yeah, she's still online, but that's her question. And she said if you don't wear mask to work, they're going to escort you and they're going to fire you.
So I have asthma and I wear a mask, and I can't, asthma's different and it's triggered by different things. Oh, I'm sorry, what was that?
Oh, no, she said something in the martial list. Anything else, Laura, that you wanted to add on?
No, I'm just talking to my coworker, my martial friend here.
Oh, okay.
Sorry about that.
That's okay. Yeah, she's going to explain to you. What about the people that have asthma? And Christina mentioned that she has asthma too. So, Christina, go ahead.
Yeah. So there's nothing with asthma that indicates that it would be unsafe or unhealthy for somebody to wear a mask. A lot of people with asthma know their different triggers, such as exercising or dust that they're very allergic to. And if somebody's asthma is very severe, or they're having a lot of troubles breathing, or they're scared of an asthma attack when they're out, it's with COVID, it's safer that they stay in. And I think you brought up grocery shopping, and we realize that not everybody has the privilege to be able to stay in when they need to, or people might work in environments where they don't have that choice. So I would recommend one worker, if you're working somewhere and you have something such as asthma that needs to be addressed, that's your right as a worker for your employer to give you a safe place to work with accommodations so you can stay safe and stay healthy at the same time. That is also something you could call our community health access program about. So that's the program I talked about earlier in the show, but they could connect you with some people to help with that. And that phone number again is 1-800-756-5437, or you can send an email to CHAP, CHAP, at kingcounty.gov, and you can talk to somebody where you can share more of your personal situation and what's going on. But things like asthma are a risk factor. It makes somebody more vulnerable to COVID-19. There's a greater chance they'll be hospitalized, and there's a greater chance the disease can be fatal. So if somebody has asthma, we definitely encourage them to get the vaccine as soon as possible. And then they'll be able to be outside without a mask, and just to talk to their physician and make sure they're getting the care that they need.
Thank you so much, Christina. I'll give you the one last question here, Lara.
Okay.
Yeah, you asked a lot of great questions. Thank you so much, and that's almost the same question that I could ask. So you have any other question about like the COVID relief or anything, or any other related health question to Christina?
Those were my question, and it's still confusing. Some of the states they don't wear masks, so I just want to know like really like what's really going on.
Some people in the country,
Yeah,
I'm sorry, they don't wear masks back in Marshalish.
Like some people, some place that I visit, they don't wear masks, and I'm like, oh, it's surprising because Seattle here,
Right.
there's a rule: if you don't wear mask, they're gonna fine you. But over there, it's up to you. You want to wear mask, you wear. You don't want to wear, you don't want. But they still no complaint.
Oh, I think I got what Lara was asking. She said that some of the community that she visited to, they wear masks. Otherwise, they're gonna fire or take that person out. In some places that she goes to, there's a gathering, and none of those wear masks, and they're still well. So I think that what her concern is, what's the difference, because of some people practice, the rules of wearing masks, and some gatherings, they still don't wear masks, but they look fine. Is that it, Lara?
Yeah.
Yes, that's the question.
Yeah, I think this is something that a lot of people think about. And I think one thing is this is a very new disease, even though we've been living with it for a very long time now, over a year with these strict conditions. It's a very new disease that scientists are still learning about. But what we know is if you're together without a mask in a small space, it's more easier that it will spread. However, not everybody, sometimes those small gatherings happen, and just by luck, maybe people there are not sick. So that is very fortunate, but you never know because people can be asymptomatic. So somebody could be sick and they could not look sick, and then they could pass it on to somebody very vulnerable. Somebody can also catch it and not be symptomatic, but then spread it to their loved ones at home. So there may not be symptoms, or those people may have been protected. And especially when you think of somebody who's, if they go to the grocery store and everyone at the grocery store is wearing a mask, and then they go to work and everyone at their work is wearing a mask, they've likely been very protected up to the point of this gathering. Yeah, there's different reasons why people might not get COVID in a gathering or why they may not appear to have COVID in a gathering. But we do know there's a lot of similar events to what you describe that have resulted in very large breakouts.
Thank you so much.
Yeah.
Thank you, Christina. I think I have someone on the
They haven't connected to
line. Oh, I saw Elizabeth. If you're on, can you come on? We saw you lock in, but we didn't see you come on. Because right now it's 3:52, and we only got a few more minutes here. So Elizabeth, if you're on, please lock in because the time is limited. For Christina, I'm gonna just play a little Mother's Day song here. While just take 1 minute here, and then we'll go back, to resume the last part of our program. So much, Christina, for your patience, with our Pacific Islanders community. Thank you so much, for answering all those important information and sharing this great information to help support everyone in our community. Also, before we end, I wanted to know we have a big upcoming program like next week with our mental health support. It's not about mental, it's about the health support, for your brain, and that's what, how you live your life every day. So we need to look forward for that next Wednesday, back at 6:00. Okay, I have Elizabeth is on the line. Elizabeth, we don't get to see your picture, but please can you ask your next question, because our time is... we only got 5 more minutes. Hello, Elizabeth.
Hi.
Hi, yeah. Go ahead.
Okay. Well, I think the only last question that came to thought of my mind is, do you see, Christina, if there's another vaccine that's going to happen again, or?
Yeah. So, do you mean an additional brand of vaccine or another shot?
Another shot. Do you think it's going to get any worse now that you're saying with the statistics that, you guys are finding with there's more people are still affected and it's still happening? Do you see that there's going to, you probably know more or best, but do you think it's going to be possibility, another requirement,
So, this is a great question.
Sorry, not a test, but another shot.
Right.
For additional protection. I'm not sure. I'm just wondering.
No,
looking at the future in the long run.
Exactly. It's a great question, and it's a conversation that is being had. I know Pfizer and Moderna are already looking at that. I would say the clear answer, or from what we know right now, we don't know. So it depends how the virus evolves, it depends on variants. But speculating based on what we know from other diseases, there have been a lot of variants. There's things like the flu shot where it changes a little bit each year, so you have a different shot each year. And part of the reason that these vaccines came into use so quickly is that a normal vaccine development, they would say, is it safe and effective? And then how long will it last? And how's the protection? And can the disease still pass through the person, even if it doesn't infect them? And for these vaccines, they found out, is it safe and is it effective? And they brought it to market. Well, they're still figuring out the other things, such as how long is it effective? So I cannot give you an answer on that. I can tell you that there's definitely conversations knowing that that will be a possibility.
Well, I thank you for giving an honest answer. And then just one more last thing. So I still noticed a lot of people are still sitting on the fence, not wanting to take the shot because they're still waiting to see how people like myself have taken the shots, and they're still, debating and waiting.
Yes.
But so far.
So yes, and I just want to, I think something that gets lost a lot is just knowing that they started these tests. So the first people actually received the Pfizer and Moderna vaccines last March as they were starting to test, because this technology had been ready for a long time, and it had been perfected, and it had been tried for other diseases, but this is the first time there was that big need. So they were ready to go, and they started testing people in March. So there are in those trials total were over 100,000 people. So all of those people have been vaccinated for more than a year. And looking at them is looking at how those people are protected is how we're figuring out the answer to your first question. How long does protection last? But it also shows that a year out, we don't see any severe side effects. So I know there's a lot of rumors about what side effects can be, or if there's long-term effects, and a lot of fear comes with that. And I think it's really smart to question, but looking at the evidence that we have not seen any harm come from these vaccines, and we have seen a lot of protection from a disease that's taken a lot of lives, hurts a lot of people, and more we're learning that COVID-19 has its own very long-term effects that can go on months and months after a person catches the disease. So we also know that the most effective messenger are who those people know. So people talk about celebrities getting vaccines and showing that on TV, or other famous people. But what we know is that the most influence within a social circle comes from family and friends. And I think also just sharing really openly, I think just as many people who are nervous about long-term effects are nervous about those side effects that can happen within 24 hours, things that just show the immune system's working, but also are not fun, like a fever or body aches. And just sharing very openly. I know some people who take the next day off of work because it feels like a slight flu and they just want to rest and recover. I also know people who don't have any side effects at all, but just sharing and normalizing your real experience over narratives that might be out there that are making it seem more severe than it is, we have found is really helpful.
Thank you.
Yeah, thank you.
Okay, thank you so much, Christina. Thank you, Lani. Thank you, Lani, for asking all these questions. Also to Lara from the Marshallese community. And thank you, everyone, for joining us today. I would like to say thank you all, for joining, and even those that were not able to speak, but they were texting, their question to us. And thank you very much. I think we're coming, it's about like 4 01. And thank you so much, Christina, again and again. Thank you for a weekly program with the King County to share all this great information, with our community. And I wanted to ask just to mention, Christina, that I know that Kent Showwear Clinic
Mm-hmm.
in Seattle Lumen Field Event Center, Rainier Beach, and West Seattle. So let's start from Kent Showwear Clinic. Clinic ko ni Kent Showwear Clinic. Moni te ke to naki koto ape. Monday through Saturday, 9 a.m. to 4 p.m. Ko Seattle ay downtown Lumen Field Event Center. Pulelulu pe mo to naki tatahata nima ke nima. Ko Rainier Beach, mo nite ke tonaki, hiva pongpong ke whātou noa. Pea West Seattle leva, hiva pongpong whātou noa, pea eo whakawa I asina. Pea ko ki motolu koe mo nofo I live or working in Federal Way, a new Federal Way vaccination site opened on May 3rd. Appointments are required in advance, but the site is specifically open on weekends. Pea te kawa te pe foki pa mo e pika wā o whai pe foki na ngai huhu koto pe I he mo ni te koto pe ka mata me hiwa pongpong ke tolu e fiafi. Ko ia ku ai wha malo atu heni. Thank you so much, Christina Predict, Sister Communication Specialist, from the Public Health, Seattle and King County. Thank you
Yes,
again, Christina, and we will definitely share this information with all our community leaders.
thank you, Sylvia. And while you're sharing the vaccine sites, hopefully I can share one last piece of information.
Yes.
Tomorrow at the Auburn Outlet Collection site that's at the Outlet Mall, Dave & Buster's has offered $10 gift certificates to people who, it's to the first 250 people who receive their vaccine after 2 p.m. tomorrow.
So it's an open outlet collection, right?
Yes.
Okay.
So if you haven't had time to schedule your vaccine or you haven't been sure, but now you really want to get a vaccine, or maybe you have a child who's 16 or 17 who's now eligible, you can go down there. You can get vaccinated as a family if you would like, with you and your child, but you can get that $10 gift card from Dave & Buster's, which is a nice little treat after your vaccine.
Yeah. So this one here that you're talking about, Christina, this is no appointments needed, right?
Correct. There are walk-up appointments available.
And what is the time frame again?
As of 2 p.m. tomorrow afternoon, they will have the gift cards at 2 p.m.
2 p.m. to what time?
Until they run out.
Oh, okay.
Yeah.
All right. Okay. Hange ko na famatala ti Christina. 2 p.m. tomorrow, open outlet collection. Ay iloa ko open mall. Ay tau no tau fito fai ki olunga. No appointments needed. Koi fe mau ka appointment. Now tu fa pe ki paanga hongo full ko ki mea offer pongi ki paanga hongo full. Ko moto ko mo lava o ki ai. They mo lava lele pe o kawatu at open outlet collection at 2 p.m. tomorrow. 16 and above, and no appointments needed. And there is a little $10. Is that a gift card or that's a little?
Yeah, just a little gift card to
little gift card.
treat yourself afterwards.
Okay, that would be good for your Mother's Day too.
Exactly.
Yeah, thank you so much again.
you.
Thank you, Christina, for all this great information and the guidelines and all this necessary information that our people in the Pacific Islanders needed. Thank you again, and we look forward for our program next week at
Thanks.
6 o'clock with the King County again.
Have a good week.
Thank you. Happy Mother's Day to you, and have a good week too.
Bye.
Thank you. Tayo, fast, sabat. Ko ia, ko e whamanatua tai pe ai ngai whae pia mo e te waki ko ia e tau whamanatua ai mahu inga o e whae. Ko ia e ngai whae, ka ki ke whi mau pe ke malu i koe pia mo e whamiri mo ngai te taki ko tau pe o ke whai. Ngā wei aki ai liko shio, kia whainga taimi pe. O ki kai ko uhi ngai ni pe ku iai ha mea o ke mau mau lao ai. Ka koe malu i whakalukfua, hange pe ko whakatau hao mea lere. Ko whakatau hao api, pe ko hao mea i he ngā we. Pe ko hape ha whainga ngā we te ke kau whakataha mo ki nau tolu, me a whainga tawhaki pe o mo ui. Ka iai lewa ha taimi o ki kai ke tuha mo tau mo o whakau kau. Pe tū take hanga tono ke koe, ke kau taha loea koe ni. O ku ki panga pe wa nima he mahina, ka koe toko ni o ku amu watu, pe nau to o ho mawhasia. Pe tū take ke pe koe ki a halot puloka, ke wano aono, nima noa wha hiwa fitu ni mataha. Wano aono, nima noa wha hiwa fitu ni mataha, pea e lava haloti puloka o toko ni i koe, ke ngahi mea koe ia, e lava ke nonga i holoto e ngai whae. Ko te whamanata taipe, ngai whamiri hono kotoa. For those of you that need like a legal help at any time, 24/7, please call Michael Haloti Puloka at 206-504-9751. 206-504-9751. Contact the Legal Shield to Michael Haloti Puloka, and he will be definitely help you to relieve all your worries and worries free. Anybody can call throughout the country, 50 states, it's all covered. $25 a month. But you don't have to go pay an expensive thousand of somebody to represent you legally. You can call now, 206-504-9751 to Michael Haloti Puloka. Okay, just remind everybody for your Mother's Day, we have all the food, breadfruit, yam, tapioca, taro, and all the food from the islands. Fresh fish from the Blue Lagoon. Fiji Market, it's known Fiji Bonanza in Kent, Washington.
Hello, welcome to Bombay Fiji Bazaar. We are here to help. Largest collection of Indonesian and Polynesian and Micronesian community. So you're welcome in anytime. We are open 7 days a week from 10 o'clock till 7 o'clock, and Sunday is 10 to 4. So all of our guys are welcome. Indian, Pakistanis, Polynesian, Micronesian. We have all the community stuff right under one roof. Thank you.
Ko ia ko ate be popoa ki tala mono ke si ngahi fofonga ko tau be ngai fofonga I whae ko tau be I he kolo e malata. Ane nai na ako sio I he ngahi ata ko ia bea me he community Tongans. First Tongan Senior Community Association in Washington. Ai au taki ai Sina aloi dafuna pe foki kia Mafi Pleasure. Ai fok mo laise pe foka Susana ka koe kausotia na nau tokoni ki ai. Koe ngai mea ko na mau I ngā ko sio ke ango fina e tau leke reka na kau I he polokalaman. Aia ko tōkanga, pea pehe foki ki ane tōkanga hahau, pea pehe foki ki a mele tanela puloka. Na si whai e na whanki ngā aue koe tokoni kono whama opo I whanki mea ke tokoni ke community tonga. Pea whia to loto. Ko ia atu lewa fo I hiwa koe ni, ma ki mō tōl ko tabe ngai whae, pe foki ki hongo whae koe ni. E na si ngā aue mātia ki mga e ofa ke community tonga. Pa koe ni o atu ia e he photo twins ai Happy Mother's Day wa hiwa ki he sāpate whae. Malo.
Ke mo ma'u hasapate fa'e fia fia. Happy Mother's Day and God bless o falahi atu.
Heo taimini e tau e atu pene e tau foi fasi ko ia ki he sapate whae, pa mo e tala monua tai peke ngai whae ko tau pe. O kui ai whoki ai ngahi tokoni lahi ai county i kono tau iai. Ngai tokoni hange ko ia whamatala mai ko ia e Christina ka koe whiwhine ko ia me King County. O kone pe, o ki ai hene ai ngai tokoni lahi ka ki motol ko ia, o ki kai kia ha mo insiua, pe ku mo mai o tu waka hene. Ke mea ke lava tokoni atu ke totongi aka ho mo ngai pila, ho mo ngai api. Hange ko mo ngai uhi la, pea moe pea whoki, pea moe ngai insiua, ki he mo ui lelei. Hange ka o ke whee au ki whare maha ki pe koe, ha pea whainga mea o ku lava ke tokoni atu. Pea au tau whamanata tai pe heni, ka paurewa o ku ke whee mau ha o raiti, ke ave koe ki he appointmenti ko ia, ke alo huhu kau ki kai kia take ne ave koe tau lahi whoki ka inga ia, koe ki nau lawa na tolo o Yahana, right? Koe kia mea lere. Pea ko ia o ko whe mau pe ke whitu taki hanga tono ke pe, ki he taha wal noa noa, whitu ni maono ni ma wha tolu whitu. Taha wal noa noa, whitu ni maono ni ma wha tolu whitu, pea o atu lewa ia ai mea lele ke alu atu o piki apu koe, ke ave koe ke ngai whitu koe ia uwhai ai hu. Tau whamanatu atu mo manatu i koe aho koe ni e wikendi, ai a ko a pongpongi, o whai ai tu whako ia i he Open Outlet Collection, o kai ki tola hongofulu, koe ki mea ofa, ka mata pe tau taha ono whai ki o lunga. Ko ia mo whai ngawe aki ai ngai whanga mari koe ni, pea o ki ai tokoni koe ki panga hongofulu, kau ka mata he wa pongpong, alo ai pe wa o ke ne osi ko ia ai tufa. Ko ia e toi o atu pene e tau hiwa ko ia ki he sapat whae, pe os ko ia tau ki Colossian ki Tonga, ka te utuko e whangamari ko ni taimini. Te whamanata tai pe whoki o kai ai polo kalama o kui ko e PPP. Ko e polo kalama ko e ni, o ku peherewa o tokoni ai polo kalama ko e ni, kia ki motolu ko ia o kia hamo ki ngai bisnisi. Ka pau kia hamo whanki bisnisi. Pea mo whee mau, ke mau hasenit ke tokoni atu ki ai. Ko whetu take hanga tona ke pe koe, ke telefoni ko tolu taha noa. Wha ua walu ono fitu noa wha ki a mere whaiva Blackovich. Ko ia ko kolenga sela ke ka tak moa toi tuku atu. Whe mau hao tokoni, ai whanki bisnisi iki, o ku iai ai ngai tokoni he ni ngai whan pe me pure anga. Whetu take ke pe koe, ki a mere whaiva, ke ne o atu me iai ai whakaikiki. Aia koe telefoni koe a mere whaiva, koe tolu taha noa, wha ua walu, ono fitu noa wha. Tolu taha noa wha ua walu, ono fitu noa wha, pia te tau toi kaupe mo mere whaiva, i e kāu, pau koe kai koho whetu taki pe au ke ne whahino hinoa, tene lava pe e ia o whaire ho pe pāma au, ta e totongi. Ka koe ne tahaia e ne ngahi tokoni ko ia ke ho tau kāinga. Ko ia whetu taki lewa ki ai, ke o atu ha ngahi tokoni me ai, o ka pau o ki ai ha o ki bisnisi. Ko ia whetu taki lewa ia ahoni te to lawa te whika, tonu taha noa, wha ua walu, ono fitu, noa wha. Te ukole ange ni ka sela ke ka takmata e taet ki whasko e whangai whae, pe te tau kolose ki Tonga ke tau ki whanongo ke ngai polo kalama ko ia sapat whae pe me Tonga eki, pe a osko ia te tau tok wha oslet lewa e konga wha os te tau polo kalama.
Wa
ke ahon o koe e whamalo.
Ko e taimini ko ki whainga maari e koe ni. O ko tuku atu lewa ai ko hono huwhi ko ia o e to o whalearea ko ia o tonga o a whewa tā. Pea e wahe atu ai pe ia. Ko tō lai fwoi ngai whae na usi i mamata mai pe i he ata. Pea koe ne e o atu ia kaki mō tōlu ke mō ke tau kau whataha i he taimini. Malo. Ko no huwhi o to o whalearea o tonga. Aia koe aho ono koe ia o me, ka koe aho ni ma whoki ne Amerikani. Koe whare area na o tonga, aia nei whakahoko whoki e hongo fulu, koe taha ua ia, koe taimi ua ia koe a Amerikani, pa koe na uplolo tonga lele i he taimini.
Ai o wau o e tāpuni whakaloto whare, ai whemea aki, mo e whakataha anga, ai whare alea o tonga, ki he tau whare alea, wanoa ua taha. Pera iai ai ngai ka veinga neongo, ai tuunga o e whanua mo e ngahi whakaehi, ko e ngahi ngā ue, na e whakahoko ke toka teu, o ka hoko mai ai COVID taha hiwa. Pea na iai mo e ngahi ka veinga ke kepe, aia na e whai ai e whemea aki ai whare alea o tonga, i he wike, ko tau situa ki ai. O ko mahino pe i he uanoa, whanonga mai ai ki he konga o e wanoa ua taha, mo e ngahi whemea aki ko ia, na iai ai ngahi lao whakaanganga, na e talia e whakataanga o e wharearea o tonga. Iai ai ngahi whakamatala whakatau, me ngahi pot ngawe ai pule anga. Koe uhi na e paasi, i he whakataanga e wharearea o tonga, i he kamataanga o e ta uanoa ke tari a e patseti, pea ke hoko ia koe lao ke whakahoko aki, ai ngā ue ai pule anga, ki he ngahi palani ngā ue na e whakatuu, ki he ta uanoa ua taha. Pena iai lewa mo i ngahi whakamatala whakatau, me ngahi tau kua tau situ aki ai, nei whai ai ai ngahi whemea aki. Ai ngahi whamatala whakatau, ai ngahi pot ngāwe, kai o maa, ai ngahi pot ngāwe, i kai whakapore anga o tū tau ataina. Pea hoko mai ai, ai whemea aki ai whare a rea o tonga o kakatoia i he hōwhituku whakaloto whare o e whare a rea o tonga i a walu e peleli wanoa ua taha. Koe ahoni, ai tua pule luluni a haono o me wanoa ua taha hōwhi ene a whio ai whare a rea ki he ta wanoa ua taha. Mahino pe i he o wau koe ni o e hōwhi toko e whare a rea i e mahina ko e peleli. Na e mea ia eksea o e whare a rea koe uhi koe patseti ki he ta o whakapaanga wanoa ua taha wanoa ua ua. Māua e ngāwe ke ai ai wa a patseti ai pot ngāwe e paanga. Pea na e tufa le waia ke mea ki ai ai hou eiki me mipa o e whare a rea o tonga. Koe uhi, koe hili ai hōwhi o e whare a rea i he tau koe ni. Pea i ai lewa ai komiti ke na u whakahoko ai tāri o e tō wholofola. Pea koe hili koe ia koe hoko atu ai ngahi whemea aki ki he patseti. Ai pule anga ki hono ngahi pot ngāwe ki he tau whakapaanga wanoa ua taha ki he wanoa ua.
Ko whakawhetai ki he otua o tua e lerei a tonga. Pea moe ne tauhi mai kakai o e whanua. O klau mai e lerei ai a eksea o e whare a rea. E pare mia mo kau minista o e kapneti. Kau whawhawhonga e ho ikno pere. Pea pehe ki kau whawhawhonga o e kakai. O kui kai whakawhia maarie, ai kai ke whakahoko e he whareni hanga aue. Hiri ai ngahi palomesi mo e tari i he huwhi o e whare area i he tau takitaha. Ko e tau kotoa, o kutataki atu e tokanga ki he ngahi makatuunga e tolu. Ko e mo i le rei, hako, mo e tuunga whakaikano mika o e whonua. Ka ko e tau kotoa, ko e tari tatau pe, kai kai ke iai hangao e makehe whakahoko. Ki muini mai, na tataki atu e tokanga, ki he pore whakalirifu e whaito o kona tapu. Ka kuhaa mai o ksisi, pe o te eki ke iai ha inasi, e wahe i makehe he whareni, pe koe pure anga, ke whakawhepaki i aki, ai pore whaingata a koe ni. O totonu, ke whakamuamua heni a pot ngā e polisi, mo e ngahi wā, o knau whenga e aki whakataha. Ko fuoloa tau, ko e tokolahi o e kau whakafofonga, o kau wai a niihi he wharen, o knau tau mua aki, ai whiri ki he whare, ai ka weinga o e whaitotonu. Koe wherewa e ngahi whakamatala ngā ue whakatau ai kau minista. Koe hā, o toa ai e he pureanga, ai ngahi whainga maari e mi he sektoa whakatup koloa tau taha. Aia, o te whito ai ngahi no me muri. O maktoaki mahu inga ke mahino koe ngāwe ai pureanga, ke whakalere ai pureanga, kai ikai koe kau he ngahi pisnisi. Ko tuolahi e ne whenga ke whakalere ai ngahi ngāwe, aia i he ngahi whanua te mokalati, koe whatongia ia ke whakahoko e ngahi pisnisi. O whemau, ke whatokanga i le rei ai ngahi poate ai pureanga, koe uhi, koe poate e ni ihi, o whakahoko ai whakalere whakaaho o e ngā ue, e kau me mipa e poate. Aia o kusisi e nau tau kei he malaiko ia. Ka whemau, ke tokanga e poate e ia, ki he ola whakapaanga, ma e kau mau inasi. Kai tuku ai whakalere o e ngā ue whakaaho, ke whakahoko ia, e he kau ngā ue kua osi teui, mo tau kei ngā ue. Ka pau o whakawhia maari ai tuunga whakaikanomika o e whanua, pia koe hārewa o kuholo ai mahu inga o e tau paanga, o whakatatau ke paanga e ngahi whanua muri o tau whakatau aki. O toi hiki, mo e ngahi moua me he hūkoloa me muri, kana e mei lava pe ke holo i he ngā e akia mea tokoni o whakatup whakaloto whanua. Ka kui kai foki ke tokoni ilahi ia he pureanga. Ko e tokolahi o e ngahi ngā e anga whakaloto whanua koe ni. O nau tuu i he mo ua lahi pe kua nau tāpuni. O kui kai ke whakahoko i he whareni e ne ngā ue koe wakai i le rei ai ngahi ngā ue ai pureanga o e aho. Ko ia o tāu ke whakakaukau i le rei he kau totongi tuku hau mo e kakai o e whanua, aia o nau whiri ai kau whakafofonga wharea rea. Ke nau whakahoko, whakapoto e nau whiri. He koe pureanga o ku i whareni. Koe pureanga ia na mo whiri ai. O tua motonga o kutowhia. Ko o whātu.
Koe tō wholofola ia, a ene a whio koe tui o tonga, a ene a whio tama ko tupo wano ki he huwhi o e tō whalea lea o tonga ki he tāo wanoa wataha. Me he taloni me palasi whakatui, nuku alofa. Ki he whalea lea o tonga i he whakatahaanga o e ahoni, tua pule lulu koe ahono, o me wanoa ua taha. Ko eiki sea o e whare a lea o tonga, eiki palemia o tonga, mo e hou eiki me mipa o e whare a lea. Nau mea ke olunga, ki nau tolu e kau whakafofonga, me he ngahi whanua muri i tonga ni. Whai e whemea aki, pea mo e wheiloa ki, pea mo e eik sea o e whare a lea o tonga, mo e hou eiki no pele, kai o maafo kia eik pale mia o tonga. Aia ko e tala whikaulahi a Australia ki tonga ni. Pe he whoki ki he ampastoa o e ampastoa ki o Siapani ki tonga ni, ampastoa Republika Kakai o Siaina ko e tala whikaulahi a New Zealand ki tonga ni. Ko e Ateni Seniale ka e pe whoki ki hono hoa. I he taim tatau pe, ki nau tohol koe ni ai hou eiki Minista o e kabineti, mo eiki palemia o tonga, wheiloa ki whiawhia, pea mo ki nau tohol koe ni ai hou eiki whakawhi. Ko e ombatmeni o tonga, ka e pehe ki he CEO ofisi o e ombatmeni, ko e hoa e skeitari pule mo e skeitari ki e kabineti, ka e umaa ai ka o whakafofonga ko e konsela whakalanglangi o e ngahi whanua muri i tonga ni. Pea i he taim tatau pe, i e wakai koia ai polokalama o e pongpongini, o wau ki he hono whakamafolanga tonu, me he whare alea o tonga, i he televisione tonga, ka umafo ki e leti o tonga uruaki, mo e FAM hiwa noa. Skeitari pule, mo skeitari ki he kabineti, ka umak nau tolu, ai kau tale ki ta pule, ai a koe CEO, o e ngahi pot ngaue ai pule anga o tonga. Ai a ko mahina pe kakato ai o wau o e ahoni, pea toki amanaki hoko ato ai ki he whakatahaanga ai whare alea o tonga, pea ki ai amanaki, e whakamafolanga tonu i e leti o tonga uraki, kai umaa i e FAM hiwa noa, ke mea ki ai hou eiki, o e whanua kai umaa ai kahainga kotoa pe i tongani mo e otu mulina. Ka katoa ai o wau o e whakamafola lehanga tonu, pea whakamalo atu ki ho mo mea mai o tau whiao, i he whakahoko whatongia koia o e ahoni. Me he whare alea o tonga, whakamalo atu mo mea.
Te taha ebe. Ko ia na motak mea mai whakia ki he ngahi whataha ko ia ai whare alea ko ia o tonga, nai hōwhia i he ahoni, nei kamata ia i he hongo fulu a ne uho. Ai ko hongo fulu ko a tonga, ko e ua ia hoata ia i ha mawhitu, Pacific Time. Pea o ke kai ngā tai o te whamanata tai te whoki, Pea te waki o ngahi whamanatu, o ngahi mahu inga, o ngahi whae. Ka koia na tau whanonga pe whoki ki he tōwholofola a ene awhio, a e tamatui ka koe tui o tonga. Koe hau ia o tau ki Otmotu, ko King Tupowono. Ko ia ai o tau whiawhia he ki mauluta, pea neongo a ngai fasta nunu, mo ngahi urunganga tae tau, ka lava pe ke kei whaka apa apai. Ai hatu i o tonga o au ke ahoni. Pea ok mahu inga pe whokia. Ke tau mui gau tau ilo o kai mahu inga. O tu e whanua, e ke tu i pe tu i, o au ke pā ngangalu. Pea koia, o ko te whaamu pe he taimitaha. Tau nowhai morini ke lava o hake o tau to tupu. Pea mo e hako tupu o e kainga tonga i Amerikani. Ke nau alu o ako ke nau hoko koha meia, koha kōwana, hoko koha Palestini i ha aho. Ka koe kai ke tau nofo tā palasia, ngai mea koe au ku hoko i tonga. O whawhawha o pito ngai polokalama toko ni. Ka koe taimi koe ia o tau whaia ngai lea toko hifo, ngai lea tae tau, o pehe tof pe ai tau whakawhia ngai mo e tae hamai. Koe o kei whamanata tai pe tau he mo ui whaapapa, koe kawe i koula e wha e tonga. Koe whakaapa-apa, koe whetau i aki. Koe fua ngahi kawe ngā whamatoa tō, pea pehe whoki ki he tau lotu. Koe ia whamanata tai pe, ai mahu inga ngai whae. O whange ke mō mau, ha te waki o sapate whae, ai o kuiai lewa pa mo ngahi pōpuaki ki Tonga, pe ki Nusila, mo tō Pureanga. Ka pau kia ha mo ngahi pōpuaki ke whakaau ka mo ngahi family, i he ope, mo ngalu ea, o ku lava pe ke wahe mai, ha mo ngahi pōpuaki, whitu taki me ke telefoni koe wano aono, tono ani ma walu o ua, o ku lava pe ke whahoko whangatone e ke le teo koe Tonga, a Katalina Tohi, pea pehe whoki ki le teo Nusila, i loga Pacific Media Network, pea pehe whoki ki Lisa Prescott Fungalei ki Sene Australia. Pea mo tau huni o hala popua. Whamaloat ka ki mo tolu kotoa pe kau taki ngā ue kotoa pe, pe whakalawani matoto. Aia pea mo ki mo tolu ko ia ngai whae i he ngahi tō whatongia kotoa pe, pe whaka Katarina Tohi ki Tonga, pea pe whaki kia Viola Ulakai, pea mo ka whahako whatongia kotoa pe, nge ko lātu manukia o kunau i he tari ko ia o e whoki mai aho nau ki i whoha pea me he ngai whamisnare. Welcome back, Clark. Ko e ki whoha koe ni, ko Clark na e wholau atu whahoko ne ngai whamisnare, ko e lava ka kato ne tau eua, pa koni ku whoki mai, ai ko ki whoha ia o lātu huakau pa mo pala huakau, pea kone whai nau tari, le leipa koe osi pe koe ni mau hoko atu ki ai. And also star Demille, you can always call the phone number. We'll put it out. The 1-800-756-5437. 1-800-756-5437. Thank you, Star, for joining us today. Koia ka pau mo whea mao hangahi tokoni. Whetu takia ke telefoni ko taha walngea, whitu ni maono, ni ma wha tol whitu. Malu mawa umain ke whaasinga koe e polokalama, koe ka taki pe kono li liwe tai mike ahoni, koe ngaka whawhainga maria, ngai whatongia keke. Ka kone hea, oke ke wika au, mau toi whoki pe ke tai meono i whiawhi, pia moi King County. Ka pongpongi, whakawhi e tai piki motol, tau kau whataha, pia moi kainga haa moa, pia pehe whoki ki e polokalama ko ia ai ka wako tutuku ko ia kolisko tupo mo Casanova Lutui. Pea i he a o ko ia ki he moni te kotoa pe, ko e polokalama ia ai vai ni hu whangalupe, ko e tānaki mai ki ai pea mo toka mololo, ko e ngahi tofi ai a o e ekino pere ma tofi ai ne awhio, ma a foto ko i aulahi. Wha maloa tai peheni ki he tāhine ko ia, ko ulaki mata ma afu, ma lo au pito ai kau mai ki he polokalama, pia mo e popo aki whaafo'ofa na ke o mai, pia e tuku atu ai pe mo ia ke inasi ai kāinga ko tape, ka tau te whitofo ke ngai whae ko ia ai vai ni u whangalupe. Ko ia ko mawa o mai eni ke whaasinga i Polokalama, pia ko kolenga mo ke asela, ke tau atu pe a ki nau tō ko unau sponsor ko ia ai Polokalama. Whamalo atu heni ke Asian Pacific Cultural Center, Executive Director. Thank you, Lua Pritchard. Happy Mother's Day to you. Also, Alatalo, thank you with the Whaasausaunga o Samoa. And also on Monday, Vainihu Whangalupe. Tuesday is the Helping Hands. And Esther Maile, and also Latu Huakau Manukia. I he tu site kotoa pe Pule Lulu. Ngai Polokalama ia mo e tau local government, mo ngai Polokalama ke tokoni. May he public health, King County, Seattle. Ko ia I he wahingani pa mo Christina Bradrick. Pea pe whamanata tai pe me he Tongan Senior Community Association. Ki mo tolu ko ia whe mao ha mo puha mea kai I he Pule Lulu hono kotoa. Ko mo whauri atu pe I he hokotatona e tahataha. Ke nau tuwhatu lewa ngai puha mea kai ko ia. Ta whamanata tai pe ki mo tolu mo whe mao. Ha mea pe o ke whaingata I ai. Pea ke mea atu. O whetu o taki hanga tonu ki a Michael Haloti Puloka, wanoa ono. Nima noa wha hiwa whitu ni mataha. Pea koe whatau kai hau mea kai ki sapate whae. O kuawa pe ahoi whitu ai whare koloa koe ni. Me taim hongo fulu o aloi ke whitu e whiawhi. Aia koe Fiji Bonanza Market ia. Ko ia te koleangeni ke tukate ngai ata koe ni pia me he Tongan Senior Food Program ko ia ai au taki atu ai a sina loi ta funa peka pia pe he whoki a ki nau tolu ko nau ngawe volunteer. Ko ia mo te wai pe ki wikaha u, whamanatu atai pe huhu, whe mao ha mo hu, mo ni te kota pe I he Pikawa I Federal Way I he 9th Avenue. Hala hiva mo e tolu ano tuli ki tonu pe I tawhaaki to'o he ma. E tā e te whaiwhase whae. E o atu pena whaiwhasko e ni ke ngai whatongia kotoa pe fuesia e whae me manawa o au mai ke ahoni ko ia o atu a maki mōtou kotoa pe. Today. Thank you for tuning in through our Pacific Islands podcast every Wednesday. We have all the great information. Next week, we'll talk about the PPP. It's like for small business, paycheck, small business to get some funding, from the government. And I'll have Mele Faiva to come in and she will explain all the detail to all of you. Ko wha maloat ko mō mea mai tau kauwhata. Thank you all. Malo au pito tau kauwhata he polka me ahoni. Pea mai vahe koe ngahi hoho. Ko Ken Soware me moni te ke tokonaki. Seattle Lumenfield Event Center. Pulelulu ke tokonaki ko tope kamata tahataha. Rainier Beach. Moni te ke tokonaki hi wā pongpong e whātau noa. West Seattle. Moni te ke tokonaki hi wā pongpong e whātau noa. Te ko alupe ki e piko wā ko ia I Federal Way. Ia toi whamanata tai pe ai tuwha, ai au taki atu ai Tongan Senior Community Association, ia mō sina aloi tā whuna peka, I pule lulu ko tā pe ke mau hapuha mo ngai supplies, kawai masks, gloves, e ngai hand sanitizer, maaki mo tōko e ngai family. Whamalo atu e ni malo apito ka whatamba ki mau tolu, te vai het pe ngai polkalama, ke e ngai tawhaki nei kai ke mō mamata mai ki ai e kamata, ana tau klosi he ki tonga o tau kawhata mai hufi ko ia e whare alea. Ko ia ko tatau atu he, and happy Mother's Day to you all, o whake mō mao, a sāpate whiawhia mō monu ia, si ngai whae, pe pe ki o mō ngai whamri taktaha. Ko au sirvia tai me aho, pe whoki ki a sela tu pofus pala te rilo. Have a good day, everyone.
O ku ta whaka mana tua maupe a e mau inga si e nau ngaue ka o ku te tai whaka o ngai maupe ai ofa si e ku whae o lau e au koe me ano ape ka toki mahino I he aho e mole ka toki mahino I he aho e mole Ki me a whakawhia Ko si e te whanongo ki he leo o e whae Hange ha mana iki o ha leo o ha ape Si leo o e whae Loto fi e mali e Ai ofa si e ku whae O lau e au koe me ano ape Ka toki mahino I he aho e mole Ka toki mahino I he aho e mole Matala I a kaulanu kulo kulae Whakailonga I a sifa e kei ngaue Matala I a kaulanu I nehinae Whakailonga I a sifa e